Hello friends, today we are discussing the posterior aspect of the upper part of the body. We have reflected the skin. Now after reflecting the skin, you get the muscle. Now this is a muscle which is arising from the spine of the thoracic vertebrae. This is one. Is get attached to the upper border of the spine of the scapula, continues upwards and get inserted into the lateral part of the superior nuchal line. After reflecting the muscle, you find the muscles, you get the bony prominences. The bony prominences are, this one is the medial border of scapula. And this medial border of scapula, on the posterior side, there are the muscles. The muscle which I am lifting is rhomboidus minor and major. The major rhomboidus major muscle is located at the lower part and rhomboidus minor is in the upper part. This rhomboidus major and rhomboidus minor, these muscles are retractor of the shoulder girdle. Above that, you have the muscle here, you have the border, and this border continues as a spine, and just this upper part continues as the upper part of the medial border. If you just go above that, you have a angle where the medial border ends and the superior border begins. This is a point. And from here, there is one muscle which elevates the scapula, that is called the levator scapulae. This muscle is a levator scapulae. Once you understand the muscles, trapezius and the rhomboidus major and minor and levator scapulae, now we'll go to the parts attached to the dorsal surface of the scapula. Now I reflect the muscle. This muscle, which is present on the dorsal surface. Now you have to understand there are two muscles are there. Most superficial muscle in the back is the muscle is deltoid. This is deltoid. This is a multiparent muscle and it has got different fibers. It has anterior fibers arising from the clavicle. That is the anterior border of lateral surface, lateral part of clavicle. Then you have the middle fibers. Here you get the middle fibers. And these are most important fibers among all the fibers. These fibers are called acromion fibers, also called the middle fibers. They are the multipinnate muscles. And these muscles, the fibers are very small, but they are very strong. And the fibers which are attached to the posterior border, lower part of posterior fibers, and these are attached to the lower part of the spine of the scapula. Now the actions of these muscles are different. The anterior fiber, they are the flexors of the shoulder joint. The middle fibers are the strong abductor which extend from the 30 to 90. And the posterior fibers which are attached to the spine, they are the extensor and the lateral rotator. I just reflect the muscle. Deep to that, you find a very important structure. And that important structure, at the surgical neck, I am just lifting it. And this is a axillary nerve. Therefore, whenever you are finding the axillary nerve, you have to go deep to the deltoid muscle and near the surgical neck. This muscle, mind it well, this nerve is always accompanied by posterior circumflex humeral artery. Mind it well, the relations. The nerve is above and the artery is below. Now I just, after lifting the deltoid, you have the muscle which is attached to the dorsal surface, and this is the muscle present below the spine, and this muscle is called the infraspinatus. The infraspinatus muscle arising from the infraspinatus fossa and get inserted onto greater tubercle of the humerus. Just above the spine, you have the other muscle coming from the supraspinatus fossa, that is supraspinatus muscle. Now coming to the action of the infraspinatus muscle is a lateral rotator of the shoulder joint. Supraspinatus muscle is very important in abduction. The first 30 degree, 0 to 30 degree is done by supraspinatus muscle. And after understanding the supraspinatus muscle and infraspinatus muscle, now let us understand the structures. Now there is a muscle which is arising from the lateral border. There are two muscles are there. I repeat, the lateral border of the scapula. The lateral border of the scapula is extending from the inferior angle up to the lateral angle of the scapula. Now there are two muscles are there. The muscle which is attached to the lower part of lateral border of scapula, and this muscle is a teres major muscle. And above that you have the other muscle that is called the teres minor muscle. The teres major muscle and teres minor muscle, the teres major muscle, they are helping into the medial rotation of the scapula. The teres major muscle, they are helping into the medial rotation of the scapula. And teres minor is also important into the rotation. Now coming to the muscles present in the posterior aspect of arm, the most prominent muscle which we can see is the tricep muscle. This tricep muscle has three heads. The part which is I am lifting and the part which is below that. There are two muscles you can see. The muscle which is present on the medial side, this muscle is called and going to the supraglenoid tubercle, this muscle is called the long head of triceps. The muscle which is present on the lateral side and coming from the upper part of the scapula, upper part of the humerus, that is a lateral head of the triceps. The muscle which is arising in the lower part of posterior surface of humerus, the muscle is medial head of triceps. Now you understood the muscles. Therefore, here you have the muscle which is coming from the lower part, and here is the lateral head, is a long head, and this is a medial head. Now you have the nerve here. Now you have nerve which is present, most important nerve you can see here. This is the radial nerve. This is the thickest nerve and longest nerve of the brachial plexus. Now I explain the course and the nerve of the axial nerve and the radial nerve. Now this is the nerve which you have seen in the upper part, that is called the axial nerve. And this axial nerve, I repeat, hardly few lines are there, but those important lines are there. Now axial nerve arising from posterior cord of brachial plexus. Here you have to remember the relation of axial nerve and the radial nerve. Axial nerve is medially and radial nerve is laterally. The first axial nerve, this arises in the deltopectoral groove, and then it goes to the quadrangular space, that is a intermuscular space, and that is bounded above by the teres major, teres minor, and above that you have the subscapularis and capsule of shoulder joint. And lower border you have the teres major muscle, this is the teres major, and you have the part, the lateral part and medial part. The medial part, you have the tricep muscle, this is a medial boundary with a long head of triceps, and the muscle, the lateral part is forming the surgical neck of the humerus. I repeat once more, the boundaries of the quadrangular space, above you have the teres minor and below by the teres major, this is teres major. You have the medially, you have the long head of triceps, you have laterally surgical neck of the humerus, and inferiorly you have the teres major. These muscles supply hardly two muscles, and these muscles are, one is the main muscle is deltoid and second muscle is the teres minor. The main action is on deltoid. Whenever the nerve gets damaged because of the surgical fracture in the surgical neck of the humerus, the nerve is injured and there is a drooping of the shoulder. Most important point among the axial nerve not only supplies the skin muscle, but it also supplies the skin over deltoid. Best way to assess whether the nerve is injured or not in the surgical neck is to take the needle and test the sensation on the surface of the deltoid muscle. If the sensations are lost, that means the axillary nerve is damaged. You should never do the abduction movement because the person is already in pain, agony, and he has damaged the nerve. Therefore, there is a fracture. In those cases, you have to take the needle and put it on the skin of the deltoid muscle and find out whether the sensations are lost or not. If the sensations are lost, that means the axillary nerve is damaged. Now coming to the radial nerve. The radial nerve arising also from the posterior cord of brachial plexus and is a relation in considered to the radial nerve and axillary nerve. This nerve is laterally as compared to the axillary nerve. And this nerve is as we say, teaching goes very simple way of explaining. This nerve is the best nerve. Best nerve in the sense it supplies B, that is a brachioidalis muscle is there. Here is a brachioidalis muscle. It supplies the brachioidalis muscle. Second, the muscle which is present on the medial border, lateral border and medial border, you have the muscle present on the thumb side. That muscle is on the opposite side. That is the brachioidalis, and that is the B. Second is it supplies all the extensor muscles present on the wrist and the fingers. They are supplied. And S for the supinator and T for triceps. Therefore, this muscle, four group you can say. One is the brachioidalis, all the extensor muscles of the wrist and fingers, and S for supinator and T for triceps. This is all about the, in short, brief about the posterior aspect of the scapula.